Engineers have transformed the medical field with robots that can administer radiation, repair joints, and even laser the brain. So, do medical robots replace surgeons, or do they make them better? Driven by technological advancements, an aging population, and a demand for minimally invasive procedures, the global medical robotics market has increased from approximately $14.9 billion in 2023 to a projected $57 billion by the year 2032. Hello, circuiteers. Imagine a beam of radiation so exact that it tracks a tumor's every move. Engineers call it CyberKnife. The CyberKnife system is engineered to deliver radiation therapy to tumors with sub-millimeter precision. Mounted on a robotic arm, CyberKnife adapts in real time to the body's natural movements, repositioning the beam of radiotherapy at countless angles to strike a tumor. Ka-cha! Without even having to cut into the patient. Unlike traditional radiation therapy, which requires weeks of treatment and risks harm to healthy organs, infection, and long-term recovery times, CyberKnife is a non-invasive treatment for prostate tumors, as well as lesions in the liver, spine, and brain, all done in just a handful of sessions. And because of CyberKnife's efficiency, this engineering innovation is being used in hospitals and cancer centers across the United States. CyberKnife is proof that engineering can transform treatment with unmatched accuracy while still relying on surgeons to guide them. Circuiteers, when it comes to robots stepping into the operation room, the numbers tell the story here. Surgeries are 25% faster, complications drop by 30%, surgical precision increases by 40%, patients recover 15% quicker, and overall healthcare costs shrinks by 10%. So if engineers can help fight cancer with CyberKnife, imagine what they can do when they turn that precision even closer to home, your joints. Meet Mako. The Mako system has a robotic arm that is used by surgeons for partial knee resurfacing, total knee replacements, and total hip replacements. Using CT scans before surgery, the Mako system software generates a 3D virtual model of a patient's anatomy, allowing surgeons to plan every cut before they even enter the operating room. Once inside the OR, your surgeon is assisted by Mako, the robotic arm based on the personalized pre-operative plan that was created for you using the Mako system, of course. The Mako robotic arm helps your surgeon stay within the planned boundaries, protecting your tissue while ensuring implants align with your surgical blueprint. Gone are the days of traditional hip and knee replacement procedures, resulting in more blood loss and greater pain. Mako provides hip and knee replacement accuracy, restoring balance, reducing complications, and speeding up recovery. With Mako, engineers didn't just create a tool, they re-engineered how surgeons rebuild the human body, one joint at a time. Now, this next robot uses a powerful laser beam.
Do you expect me to talk?
No, Mr. Bond, I expect you to die.
Maybe not that powerful, just strong enough to kill bad tissue in the brain. This next robot is called NeuroBlate. The NeuroBlate system is the only minimally invasive robotic laser thermotherapy that uses MRI-guided surgical ablation technology engineered for one of medicine's greatest frontiers, the brain. Through a pencil-sized opening, a laser probe is guided by real-time MRI imaging. Engineers designed NeuroBlate to deliver laser light energy directly into lesions, heating and destroying unwanted tissue. Unlike traditional brain surgery, no large incisions are needed. Just a stitch or two, patients recover faster, and healthy brain tissue is spared. NeuroBlate shows how engineering can tackle the most delicate operation in medicine with a kind of accuracy that doesn't just save time, but also changes lives. Today, robots can target tumors, repair joints, and even reach the brain. So the question is, what part of the body will engineers help to fix next? CyberKnife, Mako, NeuroBlade, all proof that when engineers dream beyond the scalpel, they create a future where doctors have sharper tools, patients have gentler recoveries, and surgery feels not just high-tech, but truly human-focused. Thanks for joining us. If you enjoyed this week's episode of The Circuit, don't forget to like, follow, and subscribe for more incredible engineering news.
And a special thank you to the Ming Hsieh Institute at USC Viterbi for making this episode possible.